Osteopetrosis and Erlenmeyer-Flask deformity.
Okay, a neonatal chest X-ray is in front of us. A normal neonatal X-ray, and I want you to look at the ribs and the other bones that are visible. Notice the normal bone density. There is a degree of radiation absorption within the bones as always, but some of the radiation is able to pass through, creating a unique appearance that makes you differentiate between bones and surroundings. You can see there are objects on this X-ray that have absorbed nearly all of the radiation generated by the X-ray machine. These objects appear more opaque. For example, this left metallic marker and this cable here on this side. You can also see areas that have absorbed far less radiation as compared to bones. For example, air in lungs and intestines and in stomach. But for now, I simply want you to keep normal bone density in mind. The X-ray in front of us is an example of normal left proximal femur in an adult person. There is a very clear corticomedullary differentiation. You can even measure the thickness of the cortex on both sides. This is medial cortex, this is lateral cortex, and in between there is a cavity that is known as medullary cavity, and that cavity of course is filled with lipid-rich yellow bone marrow and clearly has a different density than the cortex. Keep in mind that the bone surrounds the cavity from all sides, of course, but this is the pattern that you should see if the bones are normal. Also notice that remodeling of bones, as if the artist who created them was very professional in creating the perfect shape that he wanted to create. Let's look at another femur X-ray in a child. Again, normal bone density, and there is a very clear corticomedullary differentiation. This is the medial cortex, this is the lateral cortex, and there is medullary cavity in between. Now look at this chest X-ray. Look at the ribs, posterior ribs, anterior ribs, long bones, and the other bones that are visible. Notice the bone density is abnormally high, as if there is a high amount of calcium within the bones. There is also a poor remodeling of ribs and other bones, especially the costal ends of the ribs, which are anterior, do not look normal. Notice the similar finding in long bones. There is a loss of corticomedullary differentiation. You cannot differentiate between cortex and medulla. The condition is known as osteopetrosis. The loss of corticomedullary differentiation is because of increased cortical thickening and medullary stenosis. Osteopetrosis is a term used for a range of sclerosing bone conditions arising from the defective function of osteoclast, or even from the absence of osteoclast. Osteoclasts are large multinucleated cells that are responsible for breakdown and reabsorption of bones. And make another video on remodeling of bones that will describe osteoclast and function of osteoclast. But for those who do not know, bone is a dynamic tissue. Radiologically, osteopetrosis is identified by abnormally high bone density and abnormal bone remodeling. One might think that these bones should be very strong, but reality is exactly opposite. These are very brittle bones that are very easy to fracture. The topic is very broad, which is clearly beyond the scope of this small video, and also the list of conditions that can cause diffuse osteosclerosis other than osteopetrosis is quite long, and the purpose of this small video is to describe the most common radiological features of the condition known as osteopetrosis. Another very good example of osteopetrosis, you can see increased bone density and loss of corticomedullary differentiation. The X-ray shows another interesting finding. This boy has inguinal hernia. You can see intestines within the scrotal sacs with air and fecal material within it. So the black density, of course, is air, and it is surrounding the fecal material. Thank you very much.
So let's define it. Erlenmeyer-Flask deformity refers to a radiographic appearance typically on a femoral radiograph where there is a relative constriction of the diaphysis and flaring of the metaphysis. And the definition for osteopetrosis, as already been said, is a genetic disease that is characterized by a normally dense thin bone. So there's a clinical case about an 8-year-old boy presented with knee onset acute pain in his right leg. Radiographs show a non-displaced fracture and undertubulation of the distal femoral diaphysis and had a history of neuroblastoma. The result: the laboratory testing, imaging, and genetics testing did not reveal any hereditary or other common causes of acquired bone disease. The delineation between osteopetrotic and normal bone suggested a period of increased bone turnover followed by improved bone growth. Discussion. The Erlenmeyer-Flask deformity is primarily due to characteristic of bone instead of a genetic disease.